that it was going to come back positive.
Family members concerned about the health and safety of their loved ones. Tonight, cases continue to grow at local nursing homes that are already dealing with outbreaks.
All of this comes as the state tries to test every nursing home resident and worker in the state to try and track the outbreaks. One woman told Channel 9's Genevieve Curtis that she couldn't do anything to help her father, and Genevieve, he eventually tested positive.
Yeah, Damani, that woman's father lives here at Royal Park in Matthews. She was hoping that he would stay safe, but unfortunately, he is now positive.
It's heartbreaking.
For months, Barbie Smith watched helplessly as coronavirus spread at other nursing homes and worried about her dad, Earl.
And there's nothing I can do about it.
This week, those fears came true. Her dad tested positive at Royal Park in Matthews. Smith says her father's roommate had the virus, and she says they never moved her dad. She thinks they should have been testing residents sooner.
He's upset. He knows what's going on. He had a feeling that it was going to come back positive.
Royal Park tells us 43 residents and 11 staff members have the virus, and tells us it's screening employees and taking every safety precaution.
It's very disturbing.
This as state data shows long-term care outbreaks continue to grow. Sharon Towers in South Park, one of the newest facilities with an outbreak. To prevent outbreaks, long-term care facilities will have to continuously test staff and residents, and that will be costly. According to the American Healthcare Association, it would cost $19.9 million to test all staff members, nursing home and assisted living residents in the state of North Carolina just once. Much of that will be paid through Medicare and Medicaid. One assisted living company I spoke to says they need help and support from local health departments and the state with access to testing often to prevent the spread. Smith says all she can do now is pray her dad, a grandpa, and a great-grandpa recovers.
I just pray for everybody in the nursing homes because it's really serious. I hope people take this really serious.
And Damani, we're hearing from health officials as well as a lot of long-term care facilities that testing someone once is really just a snapshot. Someone can be tested one day and then pick up this virus the next day. And so they really need help with widespread testing in order to prevent the spread. I'm also told from some long-term care facilities that they are seeing, now that things are starting to reopen, they're seeing asymptomatic staff members that are coming back to work. So they definitely need help with more testing. Damani.
Genevieve Curtis reporting live for us tonight. Thank you so much for that report. Well, new numbers out show 13 new deaths tied to nursing homes and assisted living homes in Mecklenburg County just in the past 3 days. In Hickory, the number of COVID-19 cases at one nursing home more than doubled in the last week. Catawba County Public Health says the Bryan Center Health and Rehabilitation Center in Viewmont has 33 positive cases, including 2 workers there. The state says of the 31 residents infected by the virus, 3 people have now died. And some key trends tracking the virus in Mecklenburg County are going in the wrong direction. The county just released new data showing the trends through May 27. Take a good look here. It found deaths, hospitalizations, and the percent of positive cases all increased in the last 2 weeks. The county health director says while these were expected with expanded testing and more businesses opening up, she is concerned with people not following the rules for gathering, distancing, and face coverings. Well, across North Carolina, new cases jumped up by more than 1,000 in 24 hours. That comes after starting the week with only 176 new cases. More than 15,000 tests were completed, meaning about 9% of the tests conducted were positive. Now let's look at South Carolina. In South Carolina, there have been 331 new cases and 13 new deaths. Of more than 5,000 tests done yesterday, 6% of them were positive.
And now former Minneapolis police officer seen on video in the deadly arrest of an unarmed black man now faces murder charges. Instead of showing you the disturbing video of that arrest again, we've decided to only show this still image. The video shows now former officer Derek Chauvin's knee against the neck of George Floyd for several minutes. Floyd repeatedly saying that he could not breathe. He was later pronounced dead. The district attorney says that more charges in the case are possible. That death sparked days of protests, and we want to go now live to Minneapolis, where demonstrators are back out there again this afternoon. The impact being felt all around the country, including right here in Charlotte, which saw its own unrest after a deadly police shooting back in 2016. In light of this case, CMPD's police chief sat down with community activists today. And Channel 9's Mark Becker has been reporting on the police department here for years, including during those protests uptown. And Mark is joining us now live. Mark, you say the chief said that he is outraged by the death of George Floyd.
Yeah, Erica, he had some pretty strong words for what he saw on video from Minneapolis, almost half a country away, but certainly it rings true right here, rings all over this country for that matter. He called it disgusting and cowardly, and he said it has the potential to set back the progress we've made here for many years. In a video posted on the department's YouTube page, Chief Putney sat down with community activist Cass Atlee and the founder of Heal Charlotte, Greg Jackson. Their conversation touched on Floyd's death as well as CMPD's steps to improve relations with the black community here. The chief talked about the changes he's tried to make in the department, from changing the culture to using data to tracking and firing bad officers. He said this type of incident, though, can set the perception around policing and police officers everywhere back for decades.
We keep doing all this work, and yet the behavior of one person basically going rogue puts us all in jeopardy. It made our jobs in this profession a lot harder. It's ridiculous, it's disgusting, it's frustrating, and we're getting tired of it.
And Chief Putney said there's no getting around the race issue in discussions like this. In fact, the only way to really solve it is to confront that issue, have that discussion head on. Now, there is a group here. Hundreds have joined a Facebook group called Justice for George Floyd, and they're planning a protest march here in Charlotte, a peaceful protest march at 6:30 on Beatties Ford Road. We will have a crew there. We'll be monitoring, and we'll keep you updated. Erica?
Yeah, I know the chief and CMPD have been doing community conversations for years now, and good to see that they are continuing that now when it's even more critical than ever. Thank you, Mark. Coming up ahead tonight at 5:30, we're hearing from a psychotherapist about the impact all of this is having on mental health, especially the mental health for black men.
Well, the back and forth between North Carolina and Republican Party leaders continues as the deadline on whether to pull the convention gets closer. Well, today, State Department of Health Secretary Mandy Cohen sent a letter to the party with more questions about how the plans to safely hold the convention. It includes specifics, including how many people would attend, how would screening, social distancing, and face coverings be implemented, and what precautions the party would take to prevent the spread of the virus through those who are asymptomatic. McCollum says, quote, the state continues to support the hosting of the Republican National Convention in Charlotte if it can be done safely. Well, this was in response to a letter from the party about its safety measures and included things like pre-travel health surveys and thermal scans of all mandatory attendees. This all started on Monday when the president sent a series of tweets threatening to move it elsewhere. Well, ahead at 6, we're breaking down the CDC guidelines for conventions and taking a look at the changes the Democrats are considering for their convention in Milwaukee.
I need it just to not only survive mentally, but to keep myself alive.
That man says that for him, working out is about staying alive, not looking good. His gym, Sports Center Athletics in Concord, is preparing to reopen its doors on Monday in defiance of Governor Roy Cooper's executive order. Our Susanna Black spoke with that member about why he supports the gym's decision.
On any given day, you can find James Gibson working out.
I'm limited to what I can do physically, so any opportunity I have to escape from this chair, even if it's just temporary, is vital.
Escape from the chair his cerebral palsy usually confines him to. Workouts like this inside of a gym are a huge part of that. But he says the water is what he misses the most.
It feels like I have more freedom. I can move a heck of a lot better than I could on land because I'm weightless.
But during the pandemic, his gym, the Sports Center in Concord, had to shut down, along with the pool he usually visits nearly every day.
The biggest loss I can ever imagine. It's been terrible.
But his days of waiting could soon be over. According to a post on the Sports Center's Facebook page, the gym plans to reopen Monday morning, June 1st, a move that goes directly against Governor Cooper's executive order. The earliest gyms can legally open is June 26th, the possible start of Phase 3.
I don't want to see anybody get into any kind of serious trouble.
Even still, Gibson says he agrees with the gym's decision because he feels it's what's best for the community's well-being.
You can bet James will be on the first thing hopping back into the Sports Center because I need that sense of normality back. And people, we need our lives back.
Channel 9 reached out to Sports Center, but they declined to comment. But they did post that they plan to have safety precautions in place. We also want to mention the Sports Center tried to open in Phase 1, but then changed course after speaking with local authorities. We've asked the Cabarrus Health Alliance if it plans to allow the gym to open now, but so far we have not heard back.